Okay, we're going to call this health committee meeting to order at 1 o'clock. Counselor Anglin, would you do the blessing?
So bow our head. Our gracious Heavenly Father, thank you for this beautiful cloudy day. Thank you for the rain. Remember our troops. Just keep in mind all the people that are suffering over in Paris, France right now. And we come out of this with a better understanding of why this world is like it is today. Help our chairperson get us through this meeting, and we do a great business for the Cherokee citizens. Amen.
Amen.
Shelley, should you roll call?
Yes, ma'am. Frankie Hargis,
Present.
Brian Warner,
Here.
Bill England,
Here.
Keith Austin,
Here.
Jack Baker,
Here.
Harley Buzzard,
Here.
Joe Bird,
Honey.
Sean Crittenden,
Honey.
Don Garvin, Wanda Hatfield, Rex Jordan, Dick Way,
Here.
Curtis Snell,
Here.
Janice Taylor, David Thornton, Victoria Vesquez, David Walkenstick. We do have a quorum.
Okay. The minutes from the previous meeting are in your book. We need approval of those.
Second.
All in favor?
Aye.
We'll first go to reports with Mr. George. Is he in? Yes, he is.
Wait, here, okay. That was last. All right.
Good afternoon.
Good afternoon.
I'd like to introduce our ambulatory care director. She's newly hired. Her name's Kathy Smith.
Nice to meet you.
Well, the first item I'd like to address would be our MRI. The remodel's going along good, the construction on it, and probably the best news is they hope to have it. We hope to have it up and running and back in full swing by the first of the new calendar year. That's what we're hoping for. But in the meantime, we still have a contract in Tulsa, so the MRI service hasn't stopped at all. They're still getting sent out for that. We have a full-time flu clinic going on there in the hospital. Patients don't have to go check in and see the doctor. They just walk back to the flu clinic. They can check you in there, get you registered, and get your flu shot, and you can be back out the door in just a couple minutes. You can see we're finishing up the year real well. Our collections are up, visits are doing well. We're staying busy. Last Thursday, the Thursday before Thanksgiving, the administration, we had a fall festival, kind of an appreciation for all the hard work that the employees do there. It's always a Halloween themed. We cook hot dogs and we get out and serve those. And some of the departments set up booths, gave out candy, and we do it after work. That way the employees can go home, bring their kids. Some of the employees dressed up for Halloween likewise. Real good turnout. We have so much fun there. We have people just driving by, pull in and stop and see what's going on and have a hot dog with us. And we have it out there on the front lawn in front of the hospital. So real good evening for everybody there. Any questions?
Do you have any questions? Counselor Buzzard?
George, I know we talked about the orthopedic clinic last month being in Oklahoma City.
Yes.
When is the new contract with that going to be redone?
It's done. It's going to come up at I think right after the first of the calendar year, I was told. I believe that's what I was told.
Does the area office handle that contract? Or?
They handle that, and the last time I was down there, I had talked, and we're going to put out for bid, put a request out for bids from orthopedic services here in the Tulsa area, so that we can get the same thing going on here that they have down there. I'm going to model that, try to model that practice after the one that we have set up in Oklahoma City.
I've had a couple of calls about trips down there, and I thought, well, I'll ask and see when the renewal of the contract's going to be, and see if we can't spread it out to go closer.
Well, and our plan, or at least my plan is just to have a separate contract from them. They can have their contract in Oklahoma City, but, you know, it really puts a burden on our patients to have to drive all the way to Oklahoma City for that. So I'm gonna try to get that, going there. The hospital across town, they're in Claremore, Old Claremore Regional, they've expressed an interest in that. So, we'll put that out for bid and see what we can get.
Thank you. Thank you.
That's good. Any other questions for George? Thank you very much.
Thank you.
Easy. All right, Miss Connie.
Good afternoon. I'll just highlight a few things from the report. I don't know if you had a chance to review everything in it right now. One thing is, in September, on September 30th, we were part of the sponsorship for Oklahoma's Great 100 event. And that's where they recognize the top 100 nurses in the state of Oklahoma, with an emphasis on bedside nurses. And of all the nominees that this group received, 24 Cherokee Nation RNs were recognized out of the 100. So I thought we were represented incredibly well. And we're talking like Integris Health System, hospitals and clinics across the state made nominations for that. But we were excited about that. We have, for the first time in the history that I'm aware of, successfully recruited an IHS payback cardiologist, Dr. Michael Arredondo. He's Cherokee, and he is just a blast to work with. He's excited about seeing patients. He's motivated to see patients. He is going to be a huge success for us and a great service, so our patients can be seen at Hastings Hospital without having to drive to Tulsa. So it'll be convenient for people in Stillwell and other areas. So we're hoping to get clinics out further, but there's such a backlog right now just at Hastings that we're focusing on. But I'm hoping I'll drag him along one time and let you guys see him and meet him. He's a cool guy. The ER in September saw 6,788 patients with a left without being seen rate of 5.5%. That's about where we were before we went live with the new electronic health record. And I'm really pleased with how well the ER has transitioned, because they were still all paper in the emergency room. So to completely go to an electronic health record, that was a big challenge, and so they've adopted that really well. And I know for sure October that the left without being seen rate, volume's about the same, was 2.5%. And that is, we've never done that. So I think that
That's
shows
incredible.
its efficiency, that it's working, and so we're very proud of them for that. The surgery department performed 355 procedures in September. The dental visits, you'll see, staying very busy, 6,870 in the month of September, with, let's see, 1,039 emergency exams. So those volumes haven't decreased at all either. There's a sheet that looks like this. We don't have a document like we had before with the volumes, but this is, we kind of broke it out differently to show the visit types and kind of some numbers with that. So that's the one I'm looking at now. And you'll see that type 2 diabetes continues to be the top diagnosis of patients that we see. Hypertension is the second. And the only clinic that deviates from that is the Gadugi Clinic, which of course is not a primary care clinic. It's the sinusitis and allergies type. And these numbers don't reflect the total number of patients seen. I will tell you though on how well we're doing with the number of patients seen a day in our clinics. I really want to brag on 3 clinics right off the top. That's Three Rivers Health Center, the Oshaleta Health Center, and Nowata. They are kicking out 18 to 20 visits a day, And beforehand, I don't know if you remember, but the average across the system was 14 patients a day. And they have really embraced this new system and are just running wild with it. And we're very pleased with how well they're transitioning into that. We have good leadership across all of the clinics, but they're doing especially well in those. So kudos to those providers there. Another thing I think is nice to point out, we have to measure certain successes and how well we're working in all of our systems. But something that I don't think we've routinely reported is our Jack Brown quality. And one of the elements that they really measure and watch is the suicidal ideation of our patients admitted there, and that's one of the ways they measure success. And you'll see in the middle of that report that we had an average number of admissions of 51. Anyway, 33% of those patients were suicidal on admission, and at discharge, none were. And so that helps sustain funding for that program. Darren has ran with that well over 20 years, and he lives and breathes that program. He does such a great job. Darren Dry. We did receive our public health survey in September, on September 29th and 30th. And I think a week and a half ago, we did get a report back, maybe 2 weeks now, that we met 84 out of 99 of the elements. So we had to respond to that, and right now Lisa's speaking in Washington, actually, to Congress on public health and tribes. But we're waiting to hear, but we're feeling very good about how well Lisa Pivick and that group did for our public health accreditation. And again, we'll be the first tribe in the nation with the public health accreditation. We're approving 97% of our contract health referrals, staying busy there. Brett's doing a good job. I think that's all I have right now.
Do you have any questions for Connie? Counselor Taylor?
A couple things. That chart that you referred to at the top 10 diagnosis, I think this is the second month we've had that. I really like that.
Oh, good.
I don't know if it's the same information presented a different way, but it's good to see, so you know where to focus would be my takeaway from that. Sure. These are the things that our people are coming in for. I've been made aware of a situation where Cherokee's getting an eyeglasses prescription at Clemmer Indian Hospital, take it to Salina, and they say, we will not fill that prescription. Other clinics fill the prescriptions that come out of Clemmer Indian Hospital. That is the option that about half of my constituents have.
Right.
So I don't get it.
Neither do I, just to be honest with you. So I talked again. I haven't received a response from the people I inquired on that. But I have talked to Dr. Montgomery and Brett Hayes. I don't know why that can't happen. So I need to be diligent in communicating that expectation to Salina Clinic.
And are we 2 doctors short at Salina right now?
I believe
Dr. Ray's been gone for some time, and Dr. Totani
he's back.
is back.
Yes.
But then Dr. Childs.
I think we have one vacancy there.
Okay, and then there was Dr. Flood. Any movement there? It says on the physician, Dr. Flood interview.
He was interviewed, and so was a doctor, there was another, I can't recall his name right now. Let me see if it's on this report. But we don't have anyone right now lined up to go there, I will tell you that.
So are we 1 physician short? Or are we 2 physicians short?
I believe we're
there?
1.
Okay, because Dr. Totani is here.
Yes,
Okay,
he
I've
is.
been getting a lot of complaints about not being able to get appointments there. And I'm thinking it's partly the new system, partly we're short physicians there. So be good if we could fill those as soon as possible. And I know you're trying. So, all right, thank you. That's all I have.
Counselor Buzzard?
Yes, just to follow up on a couple of items here, Connie. I know that always in the past in reports, and I'd like to see this, is how many patients we see at each clinic. It's no longer reported. The other thing is third-party billing. That used to be reported all the time too. We no longer see what third-party collections are from each clinic, which brings to mind to me is at our J clinic, we're seeing half the amount of patients, and I don't know what our percentage is that people have insurance, but to me, that's cutting in on our bottom line as far as collection of third-party dollars. Is there not any way this system can't give us the number of patients that's seen and the number that we get from third-party billing?
Yes, we're having to rebuild every report that went, yeah, it's pretty, so we've put a group together, actually our quality management did, on focusing on what reports we want, and
Okay.
and so just last week we met, and those, any reports tied to funding, like our grants, we are required a lot of data for those, and infection controls, and then we're getting ready to do our annual survey, so we've focused, or they focused their efforts on those, and I think they did a really good job. The financials are absolutely an important part of that, and they will be part of that build.
Okay, well, that's what I've been looking for. I knew, I was giving it some time because I knew I was working on the system. And what brought it up is, and I'm just familiar with J Clinic. I'd like to also see in that report, because you do a report from Hastings Hospital that patients leaving without being seen. Can that be done in our clinics? But I have a lot of people go and say they get turned away because there's no same-day appointments. I don't know how you do it, but, you know, it certainly would be good information for you as well as me.
This, and just keep in mind, that's from the emergency room.
Yeah, okay, that's.
And that's
is there any
why-
way we could do that with the patient? And probably not.
We could.
I'd like to see it, because I have a
All
lot
right.
of people call me and say, well, can I get seen? I said, well, I'll bring it up with you.
Do that.
A lot of patients, those same patients have told me, well, we'll just go elsewhere. You know, we have insurance, or we have Medicare, Medicaid, Part A and B. They can go any place they want to.
We wanna
And
see-
they're starting to do it, and I said, well, no, we want you to come to our clinics, yeah, so.
Regardless of payer source.
So I want to make sure that, you know, we try to retain and keep those patients, because that's our clinics, and that's where we want our people to go to.
Absolutely.
There at J Clinic, people keep telling me to put on a list, and just to follow up on what Counselor Taylor was saying, that they're saying they're out as far as January as getting appointments. I said, well, at one time I knew they were keeping a list because of this new system was coming in, but do we look to getting that list down, or do you know about the list?
The J Clinic's doing relatively well, and I'll have to check with them, and maybe that can be part of the routine report, is every clinic report a wait list and how far out their appointments are booked.
Yeah, but I guess my concern was the third-party billing. Of course, I know that's your concern also, and then the wait list, and then the number of patients being seen. I understand, and I'm happy with the Three Rivers and Oceanite and Novata saying 18 to 20, but we're certainly not getting that at J. It's still,
They're pretty close.
oh, is that right?
They really are, yes.
Good, well, that's good to hear.
Dr. McCauley has done an incredible job. She's the new acting medical director there, and she has really done a great job turning that place around, and the morale is much better, and
Good.
I think
Well,
you've probably
understand.
heard
I hear
that, so.
too. The other thing is, do you have any tentative date on our opening for a new clinic in J?
I don't today.
I just quit asking.
Well, I have to. I know,
Okay.
I know. I think they're shooting for December, but I hate to even tell you something,
Well,
Counselor.
if people ask me, I say, well, we'll let you know when they're here, so, okay, that's fine. All right. Thank you, Madam Chair.
Counselor Lay?
Thank you, Madam Chair. Connie, we gained a Cherokee doctor, you're telling us. We lost one too recently. Is there any thoughts as to why we're losing docs, especially a Cherokee doctor?
Well, I'm not sure which one you're talking about. We have physician turnover, we have staff turnover, so I don't know what doc you're talking about. I mean, some people move, their spouse moves out of town, they get another job somewhere else, closer to home. That's a lot of excuses.
Well, and I don't know that I want to name names of,
We can talk afterwards if you like.
but it's someone who worked in Tahlequah.
Mhm.
Are we getting them for the payback and then we don't pay enough and they leave? What's going on?
Well, again, I'd have to talk about the specific case. In generalities, that's the only way I can answer you, sir, is depending on the situation, but generally people leave because of a relocation or a spouse moves, or they wanna live, they found a job closer to home, those kinds of things.
I'm not sure that was the reason for this one, but I'll talk to you. When we bring patients in, when we do testing on them, is there non-consensual testing taking place in our clinics?
There should not be.
And of course, I've told you that there is. Have you checked into that for me?
You never provided a name or a clinic of the patient?
I've spoken with the administration about this. They haven't gotten
I
back
haven't
to
done
you.
anything further because I have not received that information.
You're not a part of the administration.
I don't know who you're speaking about, sir.
Interesting. When you say we're up on the visits for providers at clinics, do you mean physicians or nurse practitioners or nurses or so on and so forth?
The doctors and the mid-levels.
So when somebody comes in and you don't see a doc, but you see their nurse, is that counting?
The terms in which yes, it counts, but not in the numbers I was talking about. I was comparing how we've counted it before.
And the health histories that did not transfer with the new system, are you rebuilding those?
There has been no data lost in the transition. It's still in RPMS and we can access it. And some of it still has to be uploaded whenever, at the first patient visit. It's just,
And if that's not done, what do we do then?
it gets done.
I'll talk to you about that.
Okay,
It's not getting done.
okay. That's the first I've heard of it then. We'll see. I'll be glad to talk to you because if something's happened, we need to know.
Okay, that's all we got. Thank you.
Counselor Jordan?
We're still mailing out appointment slips.
That's a funny question for today, consider, just because of something that happened.
The reason I'm asking, I had an appointment here about 3 weeks ago. I didn't get an appointment slip, missed my appointment, and I just wondered if they still be mailed out.
We are going to ask that they continue to mail out appointment slips because we'd gone to, in Tahlequah had gone to a process of calling, and it's just, there's too many calls that have to be made, and then maybe they don't answer, it's not, the system's not working, that process is not working for us.
Okay.
So I
So they will
anticipate-
be mailed out?
They should be.
Okay, thank you, that's all I know.
Counselor Creighton?
Yes, ma'am. Thank you for visiting with me a little bit
You bet.
earlier. Knocked out a few things earlier. I was curious about the different clinics. I'm sure it's just, since you brought that up, that they had the high numbers. It just hit me. How do they compare with providers like to Wilma Peak? I mean, do they just have the one drop-in doctor just like we do?
No, actually Wilma P's the only one I believe that has in the clinics, designated drop-in only. The others have like a team approach, and if you're an established patient, then they try to get you in to see someone on your team that provides continuity in your care and are familiar with you.
This is not directed at you, because like we spoke a little bit earlier,
Yeah.
I mean, you'd be on board, with more help. But I get so many calls, like everybody, I'm sure. Sometimes when I say something, I want to add it to my comedy routine because I get some giggles, because that's not the first time it's been, but this is the first time I've been on the council, so been getting a lot of calls. But it's the age-old, just super nice facilities. And people are, sometimes it feels taboo to say it, but people are expecting more providers. And I know you'd be on board with that too, so it's not
Absolutely.
aimed at you, but is it legal to ask if everybody has that same?
You good?
No, I think it's
Everybody
completely
does.
fair. We do the same, but we feel like it'd be irresponsible of us in our positions to tell you we need 20 more doctors whenever we have clinics where some docs only see 8, but others they see 20. And we need to make sure all of our docs are seeing 18 patients a day or 20.
Yeah, that would be
Before-
really, really
because
good.
That's our goal. And then I feel like if we would have a right to come and say, guys, we need some more money for some more docs.
I'm gonna advance vote for that. I will always vote for that. But thank you.
You bet. We appreciate that.
Any other questions, comments? Connie, I just want to ask for an update on the pharmacy CERNA issues. Where are we at on that?
Well, is Jeff here by chance? I will tell you that a lot of those issues have been resolved because some of the work can be done remotely. And what that means, someone can log in from another location and do some of the processing of orders. And about 2 weeks ago, Dr. Montgomery sent out a request, and we looked at workload by each clinic, and there was some capacity at some of the clinics that weren't quite as busy. So we asked them to help us work on that, and I think that's had a good impact. I haven't been getting the calls, and we're now officed in a building on site up there, so when I walk through, I don't see the blinds at pharmacy, or if I do, see them lining up, we can stick our head in and, Carrie, Jeff, what do we need to do to get things moving? And we'll have a backlog on occasion, and we will have one today, because Mondays are the worst days at Hastings for sure, but I think it's going much better.
Counselor Berg?
Yes, this is about the pharmacy as well. I guess it was about a little over a week ago. I had talked to my medical person, and he called in my prescription. I got there around 5:37, and there was a line backed up about 15, 20 people deep. And I forgot I wore my tribal council advisor that day. Because
I would never forget that.
So I was incognito, I thought. But the people were coming up to me, and they were from out of state. Wichita, Kansas, Bartlesville, they were a lot of them just out of the area there. Bartlesville, not out of state, but they had quite a distance to travel. Make the story short, a lot of the issue there, it seemed like, was that we need to inform and educate our employees just about as well as our patients. The employees were the ones that were coming up to me and asking what was going on. So we probably need to do a better job of letting employees know this is where we are, and this is why this is why certain things aren't working. So I think if you haven't already done that email that came from Dr. Montgomery, that was very well. The intent that was good. I think the employees need to be brought in and say, hey, this is where things are, because if you do not communicate with them, then it's going to be people just create their own story, and that's not a good thing to get into.
We can certainly do that.
Okay. But other than that, I waited like everybody else 2 hours or something and finally got out of there. But I wanted to go through that. I wanted to see it for myself. It had people come up to me, and some people called me a gentleman, and some people didn't. But I wanted to go through that because I used Hastings Hospital. I want to know what the Cherokee people were going through, because I heard the horror stories. It really wasn't that bad. We just need to do a better job of educating our people, and communication is the key.
I've said if we could put a convenience store in there or do a Walgreens model, then they'd have something to do and the wait doesn't seem as long.
That's right.
That's what those brilliant minds have done.
Yeah, I almost went up there and took my picture down for a while and made sure that Counselor Jordan and Walking Stick was up there, they could see those. And I was looking for Jeff Sanders' picture. I was wanting to put his and take mine down. But anyway, it worked out okay. Thank you.
Counselor Crinton, do you have?
Well, I was just pointing, saying,
okay.
I like that point about communication. There's some different issues and different things that I've been dealing with that really boils down to that communication.
That's right.
So
Yeah.
I was just pointing at him like, damn, that's
Okay.
good.
Okay.
Thank you.
If
Counselor
there's other
Watkins?
things you'd like reported in that health report, please don't care to email me, because we've talked about changing how it's set up, and we're game and open for anything.
Counselor Walking Stick?
Was this the Sooner, wherever it is? Was it designed for like an IHS facility, or is it just for like a public health care administration, because employees are telling me that, again, going back to communication, Chief Bird said, they've been telling me that this wasn't set up for an IHS facility. It was set up only for our nurses or something.
No, that's not true.
Okay.
That's very inaccurate information. I think Alaska IHS had done it, and we'd spent a lot of time with them, visiting about things that work
What
well
are
with
healthcare
it.
systems that are in our capacity, they're IHS, that are using this system?
I don't have the answer to that, but I can tell you across the world, I mean, this is probably the top, what would you say?
One of the top 2 or 3, and
Yeah.
Well, what my point is if we're using a system that doesn't meet the needs of our IHS hospital, then I'm seeing you guys done some research on this, but I don't think you guys done research on a facility or a tribal healthcare system that is successful. You guys done a public healthcare research.
No. I think what's hard right now is change.
No, I'm talking about the research. I want to
Yeah.
know
Yeah.
who done the due diligence of going to a healthcare facility and researched at it that it was a tribal facility and that it was successful and it worked.
A lot of our IT staff, Dr. Grimm,
Which tribes was it?
there were a huge amount of people that were involved in due diligence, from IT staff to physicians and nurses that participated in testing various softwares. There just aren't very many tribal programs nationally that have opted away from the RPMS system that Indian Health Service uses. So there's not very many that you can go to and say, can we look at your system? Alaska Native Medical Center uses Cerner, and the Creeks use a version of it. It's a little different version than what we use. And we talked with both of them. We had people that traveled to visit, and look at them, and we worked closely with them. And then we worked closely with Cerner for months and months. Our due diligence was between 2 and 3 years long, very long time. And then we worked 2 to 3 months, or maybe closer to 6, with Cerner to design the software to meet our needs. And it, it's still got some adjustments that need to be made, but there was a large amount of due diligence.
So we're spearheading a millions and millions of dollar software, so that how much are we saving or getting from third-party revenue? 'Cause that was the whole intent of it, right? Was to increase third party.
was to improve access and improve, which would,
Okay. So the question is, how much are we saving by going through all this headache? How much money are we saving from the third party? Like, how many millions of dollars are we talking about here?
we are not even 90 days into this new system. And it's going to take at least 6 months for everyone to get comfortable and calm down, because it's changed. And the work processes have changed, and that's what a lot of people are
So
struggling with.
here's my question: is who was the decision maker that said, "All right, let's do sooner"? Who was it that said, "Let's do this"?
There was a work group.
Okay.
I don't recall off the top of my head who all was in that.
Was it Chief Baker? Was it Jeff Sanders? Was it you? Was it Dr.
There
Grimm?
was about 20 people in that group.
So 20 people made a decision.
After we brought in 2 or 3 softwares and pulled docs, nurses, lab techs, everyone who touches the computer or the patient in, and they spent days trialing the top 3 that responded to our RFP.
So who do we point the finger at?
There's no finger pointing, it's working. So if someone
Is it-
tells you it's not working, that's
Is it
miscommunication.
Chief Baker? Is it you? Is it the council? Who do you point the finger at? Because I'm gonna let Chief Bird take my picture down too. I mean, it's my phone is blowing up for constituents and my own mother that they're not getting seen. There's a year wait for getting an appointment. There's people are waiting for hours to get their medicine. When we had a system before that worked, now we're going to a system that we're not for sure it's going to work. we're hoping it's gonna work.
This system works for thousands of patients every day. And there are some processes that are slower right now until we can perfect it. But this system is working.
Well.
And if
it's not-
anyone's saying they have to wait a year for appointment, then I need to know about that because that is not the case.
Okay. Well, I'm getting frustrated to the point that we're representing our people and we're taking a gamble. And I know you guys did your due diligence and you're saying this is gonna work, but we didn't do research on something that was identical to our situation. But we done something that was identical to a public healthcare system. But I'm hoping it works, because we're knee deep in millions of dollars, and I'm hoping this thing comes through. And I know you're under pressure, and I don't want myself or anyone else to put you under any more pressure. But I don't know. Like I said, just take my picture down from there, from the Hastings Hospital, and then we can point fingers at somebody else. Because I didn't have a decision in it. This was, I don't know whose decision it was.
We'll make sure, we are doing everything we can
Okay.
to make sure this goes fine. But to say it's not working is inaccurate
Okay,
because
thank
it's
you.
working.
Thank you, Chair.
Counselor Lay?
Thank you, Madam Chairman. And there were, I think, many companies that do this same thing, Meditech, Epic, or a couple of the other well-known ones. And so I think the frustration that I know that I have personally, first of all, I'd like to see every counselor and every member of admin and every Cherokee or native citizen who draws a big salary for the Cherokee Nation sign on to the clinic and the hospitals. Then maybe you'd start hearing a little more from other folks who you want to listen to. I don't think you're listening to our people. I don't think you're listening to us. We're very concerned about what has happened here. I'd like to know if there's an out in that contract.
There is
Can
no
anybody
need to
else
have an
answer
out.
that?
There is no need to have an out. The system
You
is
say
working.
that. You say that. You're locked into this, young lady. This was y'all's decision, just like Counselor Walkenstick said. We did not get a look at it like you did. We funded you the money. We trusted you. Our people trusted you. So I'd like to see every major stockholder in this company, which are Cherokee citizens who make decisions on a daily basis, start using the clinic system, and maybe they'll see what I've seen, what's happened to me and my family in the clinic systems. And I'll talk to you about that, and I've already mentioned some of it, but you don't know all of it. I ran it through admin. I assumed they would meet with you and discuss those things. Apparently, they don't even care. And I share the frustration. Thank you.
Counselor Buzzard?
And Connie, you can hear the frustrations, and I'm probably not as frustrated as those two gentlemen. I'm frustrated too because my people are calling me all the time. And I'm trying to be patient because I know when you put a new system in like that, it has some bugs and it's going to take some time to work it out. So I would ask you to check on J Clinic to see how many patients the provider's seeing a day.
Yes.
And look at the backlog on that. I'd ask you to do that.
We can do that, and we can compare it to last year to see.
That'll work. Thank you.
Be glad to do that.
Thank you, Madam Chair.
Anyone else? Connie, I just want to say, you know, we're going to get complaints. Like you said, when you make a change, there's always frustrations. There's always difficult situations. We had those same situations before we made the change. We had complaints. I mean, during this process of changeover, we're going to have more complaints. But I've seen that it is getting better. So I do appreciate what y'all are doing. And anytime I've had calls and relay them to you, Dr. Jones, Dr. Grimm, y'all have been very good to respond, and I appreciate that. I also want to express the sympathies of the council on the loss of Dr. Thorne. That is a great loss to his family and to us as well. And just wanted to relay that.
Thank you.
Thank you, and it's a good report.
Thank you.
Okay, we have the old business, we have none pending, new business, none pending. Are there any announcements? Our next meeting is Monday, December 14th at 1 o'clock, and, motion, second. All in favor? Aye. We're adjourned.